All right, so welcome all of our Mind Over Matter national license holders to our annual national gathering. I'm so happy to see your names on the screen, and if you want to turn your cameras on, you can definitely do that today. We will have a chance to have you all kind of tell us how things are going in your own communities and states in just a moment. But as we get started today, here is kind of our agenda for the next hour. We'll do some introductions. We're going to talk about the impact that Mind Over Matter has had in 2025. We'll talk a little bit about the annual report. We have a guest speaker, guest expert, we should say, on the Mind Over Matter program. Shatiba is going to be talking to us from the Georgia Atlanta Regional Commission and her experience. We'll go over some quick updates and reminders. And then this is going to be the time for all of you to kind of share some feedback on how things are going. So that is a little bit of an overview of our next time together here. So introductions, what we're going to do is we are going to go ahead and if you want to go ahead and give your name, the state and the agency that you're working for. And our icebreaker today is New Year's resolutions or January challenges. What do you like to participate in? And I think there's only a few of us on. So why don't we just come off of mute if you want to and go ahead and introduce yourselves. I'll go ahead and start. So again, I'm Amy Ryan and I am one of the health promotion program coordinators here at WEHA, and I oversee the MOM program. And I like January challenges, something to do in those first 30 days. And if you don't want to come off of mute, you can put it in the chat.
I will go. I'm Claire Vandervelden. I am in Portage, Michigan. I work for the Portage Zane Senior Center. I'm the health and wellness manager here. And I would probably say keep it old fashioned with New Year's resolution.
Thanks, Claire. Glad you're here today.
I can go ahead and start. Hi, everyone. My name is Jill Rankin. I'm the executive director here at the Wisconsin Institute for Healthy Aging. And I actually have a different one that's on here. My kids and I do a bingo card of a years long series of like 24 goals. There's how many spaces on a bingo card. So some of them are big and some of them are small, but it's like throughout the whole year. So I guess it kind of New Year's resolution-ish, but it's a bingo game.
Thanks, Jill. That sounds pretty fun.
Yeah.
I'll go. My name is Erin Eggert. I am the Deputy Director here at the Wisconsin Institute for Healthy Aging. And I will say January challenges just because it's the challenge part, no matter what time of year it is.
Thanks, Erin.
Hello, everyone. My name is Shatiba Butler. I am in Marietta, Georgia, and I work for Cobb County Senior Services. I am the Community Health and Education Case Manager. And I would say for my icebreaker, a little bit of both, the New Year resolutions and, like the January challenges. I like to kind of mix it, in between the two so that way it can kind of start me off in the right direction. So yeah.
Thanks, Shatiba.
So, my name is Erica Thompson, and I am with the Salt Lake County Aging and Adult Services. And my New Year's resolution, I wanna travel this year, but there's so many places that we haven't decided which one.
Well, traveling always sounds fun. Thanks, Erica. I'm glad you were able to join us today.
Good morning, everyone. So this is Ellen Pilstrom. I'm in Colorado and I work for UC Health. And I like the January challenges just because they're shorter and I feel like it's more doable for me. New Year's resolutions usually I have problems with. So thanks, everyone.
Thanks, Ellen. Happy to have you here. Lori, Jasmine, you want to share? Oh,
Hi, good morning, everyone. I'm Jasmine White, and I'm with Clayton County Senior Services. And my New Year's resolution, I have about 12. So the one I'm working on right now is to keep up with running 3 miles, about almost every day.
that's great, Jasmine. I love it. I love it. And Lori, I'm not sure if you're able to chime in or not. Oh, it looks like you're unmuted, but
Oh,
maybe not. Oh, there you go.
can you hear me?
We can hear you now.
Oh, hi. I'm Lori Rogalski, and I'm at Senior Resources here in Norwich, Connecticut. And my New Year's resolution is I just kind of want to just change my lifestyle and do things that are more healthy and more for me. I am now an empty nester, and there are things that I wanted to do, but I've always been doing for others. So it's this year, it's more about myself. And I know that sounds a little bit selfish, but there's things that I just didn't do, just like the last person. I would like to do some traveling and just to get myself in better shape than what I've been in the last couple of years because of just simple neglect.
Well, Lori, thank you for sharing. Self-care is always very, very important. Just read an article about that yesterday.
Right.
So, and here we are. We're talking about mind over matter. There's lots of self-care things that we can talk about with this program as well. So I'm going to pass it over to Jill to talk a little bit about our impact over the last year or years.
Good. Thanks, Amy. So yeah, it's always fun in January just because we can take like a little snapshot of things that have happened over the past year, the growth of the Mind Over Matter program, and hearing all of your wonderful stories through the annual reports and through this meeting. So the numbers definitely don't tell the whole story, but it is kind of cool to see the growth. So just a couple highlights to point out. Since we started this program back in 2020, it's really, really had significant growth throughout the years. As you can see, I think from every year from 2020 to 2023, actually 2024, there's been, pretty significant jumps in the number of different states and the number of facilitators that have been trained in the program, and really just the reach that we're having for women across the nation. So we over in from 2024 to 2025, though, it's been neat to see that we went from 12 states to 17 states that are working with the program. And we've had a jump in the number of workshops that we've had, about pretty much stable with the number of facilitators that we have, but we've got growth happening nationally and also in Wisconsin. So just kudos to all of you for everything that you've done to be able to grow the program. And we know that this program, as we highlight the Wisconsin growth for you, just to kind of give you an example of, many states will start off with, maybe, 2 facilitators with one organization. And it's really, really great to see that even that spread happens even in your own communities. And I'm sure you've seen that. You've seen the results of the program being successful. So just to kind of illustrate the potential for all the growth that we have. So thanks. And then I'll go to the next slide. And again, that comes down to not only the kudos, but to the thank you. Thank you for your dedication in providing this health education program within your community, especially just the ability that you're meeting the needs and meeting the health education topic that isn't really common. We know that this is a gap area for women, and we know that it makes such a huge difference in their lives. So not only are we improving bladder and bowel symptoms, but I'm sure many of you agree, just by your participants in your workshop, that we hear all the time how this program is allowing people to be more socially connected, allowing them to improve their mental health because they have more confidence and they're able to navigate the community and the things that they wanted to do a little bit more. Their social life is more rich, things like that. So it's just, it has a ripple effect. And just it's always good just to remind ourselves of the positive impact that we're having on the health of our communities. So thank you very much.
Thanks, Jill. I appreciate you sharing that as well. So I'm going to kind of turn a little bit and we're going to talk a little bit about the annual reports. So this is part of the process with Mind Over Matter with our national license holders. So the annual report material was released and you should have received an email from me about that. Those reports are due back to our office at WEHA by March 15th. And these reports, they do need to be completed by each of the license holder organizations. And you'll be submitting them through a survey link along with a facilitator spreadsheet. So the report is going to include these activities that are listed here. So the number of active facilitators that your organization has and master trainers, the number of facilitator facilitators that you've trained. Nobody has done any national facilitator trainings, so we don't have to worry about that. And then the number of workshops that have been implemented, and then the number of participants that you've had in your workshops and or completers. The facilitator and master trainer spreadsheets, they are required as part of your submission. So you're going to want to maybe print that out, get those or put them on your computer. Listen to me. I'm kind of old school. I like to write things on paper before I put them in the computer. But we're really going to be encouraging you to get that information put on to the spreadsheet so that you can upload that with your report. And then with the report, you can kind of see it on the screen. You can fill it out. We do have a sample on our website that you can print out and then fill it out so that when you go to enter it into the survey, you can enter it all in. You do need to enter it all in at the same time. So just be aware of that. And then we're also going to ask that organizations and encourage you to also share some of your best practices. There's a spot in there where you can type in some of the best practices that have been happening in your workshops and in your community. And then we're also going to collect some information to update our national map. So on the WEHA website, we do have a national map. So if somebody is looking for a Mind Over Matter workshop, they can click on the map, they can click on the state, and then they can get the information on who is offering the workshops. And that report can be found again on the WEHA website. It's going to be under the For Professionals program resources and then the license holder tab. And if you have any trouble with that, finding it, you can let me know, but you should have already gotten an email about it. And then I will also put some information about that with the recording that I send out next week. Before I go any further with that, does anybody have any questions about the annual report? If you do, you can put them in the chat as well. Erin's monitoring the chat for me today. All right. So now what we're going to do for just in the next couple of minutes is I've asked Shatiba Butler to speak with us about her experience down in Georgia. So Shatiba works with the mom license holder, again, at the Atlanta Regional Commission. She is a community health case manager at the Cobb County Senior Services in Cobb County in Georgia. And she was trained with some of her fellow teammates back in 2024, at the end of 2024. Mm-hmm. And since then, she has been involved with offering 8 Mind Over Matter workshops. So super appreciate all of that. So what I'm going to do today is just to kind of give us an idea what's happening with Shatiba and their organization. I'm just going to ask you some questions, Shatiba, if that's okay.
Okay.
And we're just going to talk for the next few minutes about your experience
Okay.
down. Did you want to introduce yourself anymore, or did I do okay?
Yeah, no, you did perfectly.
All right. Well, great. So, Shatiba, I guess I want to start out with talking a little bit about what kinds of partnerships or collaborations have you developed to make sure that you get the Mind Over Matter program out into the community?
Yes, so in Cobb County, we actually have roughly about 7 senior centers. And so when we're trying to like initially provide a program, we usually send out some information to the center managers. And so that way they can kind of get some brief information. We communicate with them over the phone or via email to kind of introduce them to, say, Mind Over Matter, to kind of let them know as far as like the logistics and the time frames and timelines of when we were considering possibly doing the workshop. And then from there, because again, we a lot of our collaborations and partnerships specifically for Mind Over Matter has been at our senior centers. The majority of the time, the senior center managers, they do like the other part of like kind of marketing the workshop or the program. But outside of Mind Over Matter, we have collaborated and coordinated with one of our local hospitals to provide another evidence-based fall prevention program, along with coordinating with some of our lifestyle coordinators at some senior living communities to, kind of get the word out, as well as providing other programs for them as well that can't necessarily come to our senior centers. So hopefully, in the near future, we can, like coordinate with some of the other senior living communities to provide Mind Over Matter, but primarily it's just at our senior centers. And
Okay.
it's been working very well.
Well, great. Well, I love to hear the collaboration, not just the senior centers, but you're getting the
Hmm.
hospitals involved as well. And so when you're recruiting, it sounds like the senior centers help a lot with the recruiting of the participants. Like, what are
Hmm.
you using to recruit those participants? Are there any um like what are you using to recruit those participants?
Okay, so I know our center managers, along with the program specialists, they usually have a flyer that we, provide for them, and with the flyer, it pretty much shows the description, like a brief description of the program, how many classes, things like that, and then from there, they put that flyer somewhere on their bulletin board at the senior center. But not only that, there is another website where they pretty much put all of the programs and workshops that they're going to have, in the upcoming weeks or months. They actually put it on this particular website. So any participant or any senior really in Cobb County that want to inquire about a program or a workshop or whatever the case may be, they're able to utilize that particular website to then register for the class or classes, so that way they'll be able to have access to that. But not only that, we also utilize social media platforms such as Facebook, on our page on Facebook, and I believe on Instagram as well. So there's different, ways of which they'll be able to get the information, and then kind of like word of mouth as well.
Great, great. Well, thank you for sharing that. And how has the community responded to your workshops so far?
The community have responded very well. When Amy and I, when we initially did our first workshop back, towards the end of 2024, honestly, we didn't necessarily know how it was going to turn out, even though, we had a full group. We just didn't necessarily know, like after the first class, if the feedback was going to be, well received or not. And so after the class, the center manager had came to us, and she mentioned to us how well everyone received this class, and, how much information that they learned as a result of just the first class. And so with us, like word of mouth is, it goes a long way. And so for this program to be structured how it is, And, the topics and the things that we talk about in this workshop, it's pretty personal. And I just think that there's a lot of women that don't have an opportunity to talk about, these issues. So the fact that we were able to be trained and then, kind of like immediately, provide this workshop to the senior centers. I mean, it's been very, very well received.
Well, that's great. And it's always wonderful to have past participants that are
Yes.
champions that are
Mhm.
talking about the workshop and encouraging
Absolutely.
other ladies to be open to this very sensitive topic that we talk
Yes.
about in this workshop for sure.
Mhm. Right, right.
So I guess my next question is what kind of challenges have you encountered, and maybe what are some of the strategies you use to address those if you've encountered any challenges
Hmm.
with offering the workshop?
Well, I think that I would say one of the challenges would be more so like the retention. So when people sign up and register, once they, come to the class to kind of get a feel of the program, for the most part, the majority of everyone, remains and comes for all three of the workshops. So sometimes we may be in a situation where they either may call us to say, hey, we're not able to make the last class, or, they may kind of let us know from the first class that they won't be able to, attend. But what we try to do as one of the strategies is we try to call them in advance, like before the program actually start. We try to call at least between a week and 2 weeks to find out, for one, if they're still interested in the program, and for two, if they are in fact able to, attend all three classes. And so once they let us know whether or not they will be able to attend the class or they're no longer interested, then if we say, for example, had a waiting list, we would then be able to pull someone from the waiting list who was waiting on, getting in the class. So that way, all that will be together and in order before the class actually start. But sometimes, you know, you may get someone who, just don't, show up after the first class. But we don't always have that. So because Amy and I, my co-facilitator, we work a lot together. That's my partner. She, we really try to bring different aspects to the program, because we understand that this program is, like you were saying, Amy, is pretty sensitive. You may get some people that may not be as open, for example. So when you provide, of course, the scripted, program, however, if you bring some of your personality to the workshop, I really think that that will really keep and retain, the participants that's in there.
Thanks, Shativa. I love the idea, and I encourage this also with facilitators to definitely reach out to participants to make sure they can attend all the sessions ahead of time. So
Right.
those participants who may not be able to attend all three sessions, do they then get offered like the next workshop that may work better in their schedule?
Yes. So if we, for example, if we have already spoke with the senior managers or the program specialists there to say, hey, since this program is going so well, we're thinking about, offering it again. Or if sometimes it's vice versa, where they come to us. And if that's the case, then we will say to that participant, if they cannot attend all three classes, and if they know that they're going to be missing, more than one, then we'll inform them and let them know, if you would like to attend our next class, we'll be able to put some information up at a particular time frame, so that way you'll be able to sign up if you know that you'll be able to attend all three. So we may not necessarily have that information right then and there, but as the class go on and we communicate with the coordinators, we usually, may have some idea if we want to do another class at that center.
Well, that's great. Well, it's great to have, these champions in the senior center also that are helping recruit participants.
Right.
Okay, so my next question is do you have any insight or lessons learned that you're willing to share with others who are implementing the Mind Over Matter program?
Sure. So, as I mentioned before, personality, it matters because when you initially start a workshop, you don't necessarily know who's going to be present in your class. You're going to have different personalities. You're going to have some participants who is very bubbly, they're very open, they're very personable, they love to talk, right? And then you have other participants who's like the total opposite. And so when you go in not necessarily knowing, everyone at the time, I think one of the ways for you to kind of be able to kind of figure some things out, I would say for me in my head, I'm very observant just by nature, but you really have to kind of listen as well to what everyone is sharing, and just really just adding some humor. I think that kind of helps out as well, because this topic is sensitive. A lot of people don't talk about it. Now you may, the participants, some of them may say, oh, well, we talk about this amongst ourselves, or, our friend group. But, like, you may have some that don't talk about it at all. And this is just an issue that they've been, like suffering or enduring for however long. So it's like when you allow for them to, feel safe, and just let them know that this is a safe, place, and that whatever we communicate in this workshop remains in this workshop. A lot of times that give them a little assurance to say, okay, well, I can share this. And then especially if you have ladies in there that, of course you share this, some or similar stories, because some of them, to whatever degree, they're suffering, from the same type of symptoms or, situations. So just being personable and being warm really goes a long way.
Exactly. And it's really the facilitation.
Yes.
It's hearing from the participants and what they've
Mhm.
experienced and what they can share.
Absolutely.
And bringing some of their personalities into the group as well.
Mhm. Right.
Well, Shatiba, thank you so much for sharing some of your insight. I really appreciate it. I know you're doing great work with your fellow teammates down in the Georgia area. And I just appreciate you being with us today. So thank you.
You're so
I
very
don't know.
welcome, Amy. Thank you.
I don't know, Erin, were there any questions for Shatiba in the chat?
No, I don't see any.
Okay, perfect. Well, if you have any questions, you can definitely put those in the chat as we're finishing up the meeting today. But we're going to continue to move forward with a few of the WEHA updates. So I want to go over those. And you may know some of these, and it's always good to have a friendly reminder. So the first update is this past summer, a mom was successfully translated into Spanish. So we got a grant, and we were able to do that with Erin's help in a very short amount of time this summer. So any bilingual Mind Over Matter facilitator may purchase the Spanish manual and then offer the workshop in Spanish. So there's not an additional cross-training required. So I think that's a great thing. And then any new facilitators can complete the training in English, and then again purchase the Spanish manual, and then be able to deliver the program in either Spanish or in English. If you're interested in those manuals, they're $100, and you would contact our office, and we would get that mailed out to you. And we are still hoping to culturally adapt the Mind Over Matter program in the future. So right now it's just been translated, but that we're a step in the right direction. So that's a good thing. And then while we were preparing the manuals for the translation, there were also some minor updates made to the English facilitator manual and the participant guide. So these updates, they just included like removing some blank pages, updating a few page numbers, nothing real major, but as long as we were translating it, we decided to just update it at the same time. So facilitators may choose to purchase an updated version of the facilitator manual, again, by contacting the WEHA office. And the cost is $100. However, the previous version of the manual, it remains valid and can continue to be continue to be used. Erin just dropped a link into the chat. Thanks, Erin. And this is a document that we shared over the summer with some of the page number changes and things like that. So you're going to want to make sure that your facilitators, if they didn't receive that over the summer, that they get that information. And I will also put it in the notes that I send out with this recording as well. Also, the participant guide was updated, like I had mentioned. The updated copy has been added to the WEHA store and to our website. So the most recent version is there. Any questions about the update in the manual? Okay, well, I'll keep moving on then. So also in 2025, we have updated the fidelity check process. So this was something that we at the WEHA staff, we talked a lot about how we could do this, and we talked with the developers, and this is what we've come up with. So if a trainee, when they're taking the Mind Over Matter facilitator training, receives an 80% or higher on both their key elements quiz and their practice facilitations, then they will not need a fidelity check or a fidelity coaching session. And the trainees and the license holders will be notified if that fidelity check is required. If a trainee still wants to have a fidelity check, we are happy to complete those checks based on our capacity to do that. So just reach out to me and we can talk about that. There is one little slight difference. If someone is interested in becoming a Mind Over Matter master trainer, they will require having a fidelity check done prior to taking that master trainer training. So just as you're thinking ahead on possibly training master trainers, we do need to have that fidelity check completed prior to them taking that training. And again, you can reach out to me and we can talk through that process as well. And then data collection, always super important. Our developers love to have the data and hear about how this program is working throughout the United States. So we are asking license holders to complete the pre and the post surveys using our WEHA data collection tools, which are available on our website under our MOM program resource page. And we really do value that data and appreciate everyone who has been submitting that data as well. So I see in the chat, Claire, you had a question. What's the difference between a master trainer and a facilitator? So a master trainer actually trains the facilitators who then go and facilitate the community workshops. Erin, do you want to add to that? I saw you come off of mute. Okay.
Perfect.
Okay. So think about if you are a Mind Over Matter facilitator, it would have been the master trainers would have been the two people or one person who would have been leading that training that you took.
Thank you.
All right, you're welcome. All right, so we have another page of some updates and some reminders. So certification reminders. This is always a good time. We're at the beginning of the year, New Year's resolutions or just January challenges. Just as a reminder, facilitators need to lead a community workshop every 12 months to remain active. And master trainers need to lead a facilitator training every 24 months and complete one community workshop every 12 months to remain active. So we are asking that you just make sure that your facilitators and the license holders are keeping track of your certifications. Excuse me, of your workshops, so that you know who is an active facilitator or master trainer. And so now I'm going to turn it over for the next couple bullet points to Erin to talk about the renewal process and basic training.
So just briefly, your license renewals, remember that your license for Mind Over Matter is good for a 3-year period. So typically I will reach out to the primary license holder 90 days ahead of the expiration date to get a renewal started and just touch base with you on your plans for moving forward. If you are with an organization that kind of has a longer time period, that we have a very big range of how long those renewals take or new licensing. So if you're somebody who's with an organization where those contracting periods, take longer, feel free to reach out to me ahead of time. Or some of them that I have documented, then I might reach out a little bit ahead of time of that as well. But typically it's right around that 90 days when I'll reach out and touch base on what your plans are for moving forward with the Mind Over Matter license. If you ever have any questions about the licensing or anything, feel free to reach out to me about that as well. And then just a reminder for basic training, I don't think this is actually applicable for anyone quite yet, but when you do, or if you ever do have master trainers, the master trainers and license holders are required to ensure that all facilitators who will be taking an upcoming facilitator training have completed basic training prior to attending that facilitator training. So again, that is just a requirement for those master trainers and the license holders to do if you have master trainers who are facilitating or leading a facilitator training. We just need to make sure that all trainees have completed that required prerequisite. And if you have questions about that, you can always reach out to me as well. And then one other big update with basic training is, and this almost slipped my mind, is we are in the middle of nearing the end of updating the basic training. So I think if you're a trained Mind Over Matter facilitator, you have been through our basic training course. We are working in updating that, and that should be released in the next 1 to 2 months, hopefully. Maybe even sooner, but we have completely reworked the basic training itself, and so it's going to be a little bit more, hopefully, user-friendly. If you have taken that, you know that you got a code at the end of each module and you had to enter that code. So we're getting rid of all of the code aspect thing. I know that was kind of burdensome for a lot of people. So hopefully this will be a little bit smoother to work through, and just for anybody, you guys have already taken it, so it won't be applicable to you, but for any new facilitators that have come or that become trained, they'll be hopefully taking that new training, which again will be coming out in the first quarter of this year. Great.
Thanks, Erin. Appreciate it. And I think it's always good to go back through basic training. I'm going through basic training again right now to kind of look at it. And it's just a great reminder of the great work that we're doing and how much we can help other people as well through this work that we're doing. So the last little bullet point on this slide is just as a reminder, all of the updates that WEHA sends out will be going just to the license holders, not directly to the facilitators. So please, please, please make sure that you're passing on anything that may apply to the facilitators to the facilitators in your communities. All right. And then speaking about great things that are happening in 2026, I still have to think about what year it is. So 2026, we have 4 Mind Over Matter facilitator trainings that are scheduled. We do have one that's coming up in February, so the closing date will be coming up soon for that. So registrations do close 30 days prior to each of these training dates starting. This gives our trainees an opportunity to complete that basic training modules that Erin was just talking about. and then also gives us time at WEHA to place the order for the materials, ship the training materials out to where they need to be. So these are all virtual trainings. I did adjust the time a little bit because we have facilitators that are on the East Coast and all the way to the West Coast. So we've tried to accommodate the times for everyone across the United States. And just as a quick reminder, you can see on the picture just to the right here, if you're interested in any of that training information and registration forms, they can all be found on the WEHA website under the For Professionals tab and then Becoming a Facilitator. And if there's, we just would love to hear from you if you're interested in being trained or having other facilitators trained in Mind Over Matter. And I will just say, signing up sooner than later is best. It really helps us at WEHA make sure that we have the best facilitator training that we can have. So love to get those filled this year as well. All right, so now I feel like I've been talking for quite some time here today. And what we're going to do now is I would love for you all to come off of mute. You can show your faces if you so desire and tell us a little bit about what's going well with your Mind Over Matter workshops. What isn't going so well? We want to hear that as well. And then also what other helpful supports might be available or might be you might be interested in.
Oh, I can go first, Amy.
Yes, Erica, I'd love to hear what you have that's happening out in Utah.
In-person workshops are going well. We get a lot of great participation. We just last week I started 2 workshops, and one we had 12 participants, and then another one we had 14, which it was a little big of a number. But you know how sometimes not everybody comes, so we were okay, we leave it at 14, and some of them might not show up. Anyway, so it's going great in person, but we really struggle with the virtual ones.
Okay.
We promote on social media and our virtual senior center, and we still don't have enough to run the workshops. So that's kind of like it will be helpful if we can get some ideas from this group.
Oh, that Erica, you must be a great mom for facilitator. You're going to ask the group for their input and their shared experiences. Has anybody had success with the virtual workshops?
So, hi, Amy. This is
Hi,
Ellen.
Ellen.
And actually, our virtuals actually do better than our in-persons for some reason, just because people tend to like not to travel. And so, and we do have a newsletter that goes out to the community. So, again, it just depends on the community. Ours is the virtual works really well. I'm just going to go through what isn't going well. I think we've mentioned this before. My facilitators have come back and often said to us that we get really good participations 1 and 2, but for some reason, 3 people just feel like, I don't know, and it's really been difficult for us to get those 3 in. They'll come to 2, but then for some reason, the third is just kind of like, eh. And so we're working on that. So again, if the group has ideas on how to encourage that third one, I'd appreciate it. So, but yeah, otherwise it's going really well. Like we get really good information back from the facilitators and the participants that they love the class and that they are doing better. So yeah, thank you for creating Mom. It's been a great community support. So.
Well, thanks, Ellen. And thanks for sharing about, the virtual workshops that you've been having. And I just want to go back to that real quick, Erica, and share a little thoughts. And then Ellen, I want to get some input from the group too on session 3. If you can offer the workshop maybe to a wider area, maybe that would help with the virtual workshops. I don't know if you've tried doing like a session 0 to help with the technical support. I know that when I've done virtual workshops, that's what I've done is I've provided an opportunity to do a one-on-one session with the participant. And then we come together for like a session 0 to make sure that technology is not so scary. There are still some, they just need some folks that just need a little bit more help with the technology as well. Shatiba, you had a question I saw pop up in the chat on the side. Can you post nationally to recruit from beyond your area? Jill, Aaron, I'm going to ask your thoughts on that as well.
So someone asked me that just for clarity. Did someone ask me?
Oh, no, I was just reading your question. Reading your question in the chat. That was Amy. Sorry, Amy. Your name has come up as Shatiba. So
that's why I was trying to figure. I was trying to figure out. Like I didn't write that.
Amy is sneaking into the meeting here.
Aaron, do you want to take that one?
Sure, and then you can add to it.
All right.
Anything. I think we typically recommend that you don't promote nationally, but if you have interest from somebody, like if there's somebody's mom that lives in a different state and they want to join them too, then we wouldn't discourage that.
Yeah, and yeah, the reason behind that is because we don't want to have to like if there is a state that's running a mom workshop and then there's another state that's running, we wouldn't want to take participants from that other state. So that's why it kind of gets a little fuzzy. So we try not to intentionally do that. But like Aaron said, if you've got a couple people or 1 or 2 people that happen to be from another state, certainly it's not like we would say, no, they can't attend. But we want to do our best to make sure that the state that they live in, that they're accessing those services first. Mm-hmm.
All right. And now I just want to get back to Ellen's question too. Does anyone have any ideas or as far as encouraging our ladies to come to session 3? What have you done to make sure that they attend session 3? Go ahead, Claire.
So one thing that we have done, it sounds like all of us have kind of agreed on, we get the people, we let them know ahead of time. It's important to try to make sure you can come to all 3. But we work with seniors, so things come up, people get sick, things like that. What I went ahead and did in our advertisements for these, I just go ahead and I added another little blurb at the bottom, and it says, given the high demand for this class, we strongly encourage full attendance to help you get the most from the class experience. We understand that emergencies arise, but please try to prioritize your schedule so you can attend all 3 sessions for the full 2 hours. I don't know if anyone else has got the people who come as well, and then they say, oh, I have to leave halfway through. I have to go to an appointment. So I just let them know ahead of time. There's a lot that we cover in all 3 sessions. It's really important that you try to come to all 3. Another thing that has helped, we send the friendly reminder letters. So those will remind people when the next class is, but I also got a lot of good feedback that they appreciate when I send text and email reminders as well. So I usually do that like 3 days before our next class, just reminding them when our next session will meet. And that also is a good reminder to remind them to be doing the exercises as well. And then on the first class, I know Ellen had mentioned that it's her 3rd class that people aren't coming to. I think all three sessions are valuable, but I really think that third one is so helpful because that's when we cover all the information on how to open up to your healthcare provider. So usually on the first class, I kind of break down in the beginning before we get into the books, I kind of break down what we're going to be covering in each session so that they know, okay, I should probably make it a priority to come to that third one because I have struggled with bringing this up to my healthcare provider. I think those brainstorm posters we do in the third session are really, really good. I usually take pictures of all of them. So those are kind of the three ways that I do the text in the email, that written description, and then kind of breaking it down on everything that we will be covering in the three sessions. So I hope that helps, Ellen.
Thanks, Claire. Oh, and Amy is saying in the chat that they charge a little to reduce the no-shows. And reminders and reiterating practicing the exercises is good. Thanks, Shativa. Those are great ideas. All right. Anyone else want to share what's going well or what isn't going well? This is the time that we want to hear about it. All right. Well, I'm not seeing anybody else wanting to share anything else, but I do want to just remind each and every one of you that we are on the Mind Over Matter team. It's not just WEHA and our license holders. We are one big team. So if there are things that are going well, we want to hear about it throughout the year. Make it like your bingo card. Jill's bingo card, she adds in, share with us some of those great things that are going on. Share with us some of the things that you might be struggling with. This would be a great time then for me to reach out and talk with others and see if there's anybody else experiencing those same issues. And then we're always open to hearing about what other supports would be helpful to all of you. And then, working together to create some of those things. They don't have to be created by just the WEHA team. Like, Claire, I really like your statement. Like, I might be stealing it or copying it and making it available, to other facilitators throughout the United States so that they can, add that in and hopefully help with their retention in their workshops as well. So is there any other questions that anyone has?
I'll add something. I hate doing this, but I will. I'm Lori.
Yes,
and
Lori.
I was very lucky. I did 4 of the Mind Over Matters this year, and they really caught on. Some of the folks that were in my first class had relatives close by that was at another senior center, and that senior center requested us to come do a workshop for them. And it seems like 3 out of the 4 workshops again had requested us to come back for this coming year. 2 different individuals at one of my workshops had taken their information and their booklets to their primary care doctors. And in our area, we have a huge shortage of doctors around here. And 2 of their APRNs was very, very excited about the information. One of them had asked us if they could make referrals to us so that they could take the workshop. So I already started this new year off with a list of individuals who want to take the workshop. So 3 of my workshops, I would say, was extremely successful. The 4th one was not my fault. Somehow in their newsletters, they had made it to be a choice either to come on one day or the other. So they had volunteers who does their newsletters, and the way it was written, it didn't come across. So the first time we only had, I think, 2 people, but we went for the second time. And then we had another group of 4 people who didn't come to the first. So what I actually did was we started all over again and did the first workshop. Excuse me, I have a bad cold today. And then what we did was repeat the next class so that we could get all the classes in.
Okay,
So,
well, that would be a great way, Lori, to overcome that. And hopefully that won't happen with the advertising in the future,
right.
for sure. But I love that your participants took their booklets to their primary healthcare
Yes.
providers, and now you've introduced this program to the medical community as well, and hopefully you'll get some more referrals for your future programs there as well.
Mhm.
So keep
So,
up the good work.
yes, thank you very much. And to the virtual, I do not like doing virtual. I do the Live Well workshops, and we did so many that was virtual. And I used to get really very upset because as you're teaching it, you see so many people jumping on, jumping off the Zoom, or they're doing other things instead of paying attention. And we spent so much time working with a lot of individuals who couldn't get connected or who got knocked off. And my partner would be calling them up, trying to get them on. So I don't really like doing them. I really like sitting there face to face. I think when you're sitting there, you can really read into each individual. They can also look at you and see how compassionate and how understanding that you are, and they're more apt to be open and share their stories with each other. And I think they do a lot more bonding when they're in the same room. And and I think I forgot to mention 2 of my workshops asked us to come back 6 weeks later. So I was very
Good.
excited about that they wanted me to come back and return. So I did hear some updates on them, and I thought pretty good attendance because one had 6 individuals and the other one had 7. So for a class that was already finished, I thought that was pretty good attendance for them coming back. And some of them actually already had made appointments and made referrals for themselves. So that was really exciting to hear.
Oh, Lori, thank you for sharing all those great things that were happening in your workshops and how you overcame some of those things too. And yes, I think there's definitely an area for virtual. There's definitely an area for in person. It kind of just depends on what your agency and what your comfort level is to doing some of those things. So,
Right.
So thank you for sharing. So I think we're coming to the end of our time together, but I do appreciate each and every one of you. On the screen is Jill and Aaron and my contact information. So we are happy to hear from all of you on how things are going throughout the whole year. So thanks for attending today, and look forward to hearing from all of you soon. Have a great day, everyone.
Thanks, everyone.
Thank you.
Bye. Thank you.
Thank you.